Well, for more on methods to contain the pandemic and what the possibility of a nationwide shutdown will mean for the US, I'm joined by Dr. Chen, an assistant professor of public health at Yale University. Dr. Chen, thank you so much for coming on the show.
Glad to join you.
So the buzzword across the United States now, social distancing, people being urged to reduce contact with others. How important is this advice at this stage?
Yeah, this is super important because that will avoid people to inhale droplets or being affected by touching others like a handshake. So that will try to minimize those things. But I think there need to be something more need to be done. For example, with should be having a smaller or lower cutoff for social gathering. So far, it is advised all events above 50 people should be canceled. But I don't think 50 is enough. Should be even cutting even more. So basically, avoiding all kinds of non-essential travels and social gatherings, meetings. And I think the next thing very important is the testing. So we should emphasize 3 times: testing, testing, and testing. So with the testing more adequately being done and roll out in all the counties, all the neighborhoods, then people understand their own risk and their risk at the community and at their family. And this will give a very better idea about the status of the infection. For example, the infection rate and also the case fatality rate. Those 2 numbers are critical to judge whether the adequate measures have been done. If the community still see a rise in the fatality rate, then probably more measures have to be done. And that will also inform the government to devote more resources to those really in greater need.
I'm glad you brought up testing, Dr. Chen, because in the last few hours, as we reported, the WHO Director General saying, the most effective method now is to test for the coronavirus, but testing kits have been so slow to roll out in this country. Does this worry you?
Yeah, exactly. So some of my colleagues and I, we have issued another open letter trying to persuade the government to adopt a public, we call it public and private partnership, to adopt some test kits from the commercial firms in order to test them. And we should fasten the test process. Like the CVS, pharmacy, Walgreens, they are all opening the test station at their parking lots. So which will accelerate this process. I hope this will come soon. So it's already said that if this can be true, then it will just take 3 hours to have everyone tested to get their results.
Well, compared with Asia and Europe, the United States has not seen a big wave of infections. What can be done now to ensure that hospitals and the healthcare system are ready should this wave arrive? All right, we've just lost Dr. Chen Shi, but still to come.